All right. Good morning, everyone. On behalf of Screen NJ and the Rutgers Cancer Institute, hello and welcome to Community Cares and Project Echo. Thank you so much for attending today's session. We hope that the information shared today will help you serve your community better. I have a few announcements before we begin. Throughout the presentation, please keep your microphones muted, enter your questions in the chat box, and as a reminder, we are recording today's webinar. There's a few different things about today's webinar um, that I'll get into. So, a disclaimer, the information contained in this presentation is not substitute for medical consultation, and a physician should always be consulted for any health problem or medical condition. So this is today's agenda. We're going to do a Project Echo series overview, introductions, the presentation, a case study, and the Q&A. So today's Echo is going to be a little bit different because unfortunately our presenter was unable to make it to the live session. So we pre-recorded the session and we'll be playing that. And since we weren't able to do questions and answers, the last 10 minutes of the recording with him, I asked him questions that I had my team come up with. And he said that if we had any questions throughout the Echo, we can put them in the chat and I will send them to him, or you can put it in the Mighty Networks and he'll answer everything there. So, a little bit about Project Echo. Project Echo is a movement to demonopolize knowledge and amplify local capacity to provide best practice care for underserved people all over the world. The Echo model is committed to addressing the needs of the most vulnerable populations by equipping communities with the right knowledge at the right place at the right time. So, for more information on Project Echo, you can go to echo.unm.edu. So, our presenter today is Dr. Eshan Patel. Dr. Patel is deeply committed to ensuring that every patient has access to top-notch oncology care. He has enrolled many patients in clinical trials, providing access to novel therapies, and has contributed to research across various cancers, with a focus on molecular biology, driver mutations, and precision medicine, and the integration of immunotherapy approaches. He is passionate about serving the community he grew up in and strives to reduce the burden of traveling long distances for advanced cancer care by offering high quality treatments close to home at Steeplechase Cancer Center in collaboration with the Rutgers Cancer Institute. This partnership gives patients access to innovative treatments that and cutting-edge clinical trials available at NCI designated cancer centers. Dr. Patel's approaches every patient with the same care and dedication he would offer a family member, and he looks forward to each day supporting and guiding patients and their families throughout their cancer journey. So unfortunately, he was unable to be here today because I think he had patients today. But he was really kind enough to pre-record the session. So before we begin and go into the recording, here's a quick pre-test. And this is our first time, I believe, covering oral cancer. So regular dental checkups twice a year can help lower the risk of oral cancers. True or false? Oral cancers can develop without pain in the early stages. True or false? HPV is one of the major risk factors for developing oral cancer. True or false? All right. So now we're going to go into the recording. I'm going to unshare that screen and then pull up the recording.
While Sarah's doing that, I also want to let you guys know, if you have a question, if you put it in the chat, we'll copy it and then make sure that Dr. Patel gets that as well. So if you do think of something, feel free to put it in the chat.
Okay. Everybody can see and it's on the big screen. I'm gonna mute myself. You can't hear it?
Sarah, you may have to unmute yourself.
Oh, maybe. Yeah.
Good morning, everyone. We're going to talk about today a very important topic about oral cancer prevention and screening, mounting of oral cancer. I think we do a pretty good job in terms of cancer screening for colon cancer, lung cancers, breast cancer, but I think oral cancer is also that has been seen more and more prevalent in our communities, and I think we need to have better education on oral cancer prevention and screenings. So, oral cancer statistics in United States, each year approximately 54,000 new cases of oral cancers are diagnosed. About 11,000 deaths occur annually. The average age at diagnosis in early 60s and nearly 60% occurs in adults aged 65 and older. It's very important to have regular oral exam, either done by your primary care physicians or your dentist, or just even self-examination. And we're going to talk so much today in depth about different areas that you can self-examine to avoid or palpate some cancer abnormality in the early stage. Men are about twice as likely as women to develop oral cancer. So New Jersey stats are here. In 2022, 959 men were diagnosed and 417 women. So as you can see, almost double of men were diagnosed in New Jersey, nearly 1,400 New Jersey residents in total. So what is oral cancer? Oral cancer is a cancer that starts anywhere in the oral cavity or oropharyngeal area. As you can see here in the picture, the oral cavity contains of your lips, tongue, gums, inner cheeks, roof or floor of the mouth, and throat. And then oropharynx is back of your mouth where a lot of the structures are there. Your larynx is there, you have your pharynx is there. So those are the different pipes that basically carries your food from your mouth to your intestines, or is your air from your nasal cavity down to the lungs. So any in this area, any cancer that arises are oral and head and neck cancer. Important to know, if often does not hurt at first. So like any other cancer, the symptoms are always present at late stage. So that's why it's very important to find if any abnormality, get care right away. So as it's not painful or there is not any other major symptoms, people can avoid seeing a doctor, and then by the time it starts causing symptoms, it might be too late, it's already spreading. So it does not hurt at first in a very early stage. It looks like a common sore at times. My rule of thumb is probably any sore, ulceration in your buccal cavity area, if that's not healing over 2 weeks, is very suspicious and you needed to get checked. Anything that's getting better, if it was a sore that gone away, it should be okay. But if it's a sore that is persistent or getting worse in 2 weeks of period or beyond, you should definitely get it checked. It can spread if untreated, and that's why early stage detection is very important, because early stage detection might require very small surgery and you'll be curative. If it spreads, then it might require much major surgeries and other treatments. So I think it's very important to catch it as early as we can. So what does oral cancer look like? Here is a picture of that sore that I was talking about. You know, we all get sore. It's very common even after some viral symptoms, viral prodrome like symptoms, you have to get a sore, which is a normal immune system response. But if this sore is getting bigger or persistent beyond 2 weeks or starts causing ulceration, you should definitely bring it to some physician or some medical professional's attention. Signs and symptoms: white patches, leukoplakia; red patches, erythroplakia; red and white patches, which is, again, as I said, if something that is not normal, is something you see new and getting worse; sores that do not heal within 2 weeks; lumps or thickened area; bleeding without injury; ulceration; also any lumps or bumps in the neck area. I think those are very important to bring it to attention. Other symptoms, this is usually happens when it's not early stage and progress beyond, or it can be early stage if it is involving the pharynx or larynx area. So difficulty chewing or swallowing, ear pain, loose teeth, jaw pain or swelling, chronic bad breath, unexplained weight loss, lump in the neck, hoarseness of voice is another one, big one. So hoarseness of voice that is getting worse. I think those are definitely need to get further examination. And any symptoms of those, as I said, symptom has to be persistent. It has to be getting worse and lasting more than 2 weeks. So, people do have those symptoms with common illnesses as well, right? So if it's viral infection or bacterial infection, usually things gets better within few days. But if it's persistent, that means something else is going on. What are OPMDs? These are oral potentially malignant disorders. So those are probably not cancer yet, but pre-cancerous condition that can cause or if left untreated can become cancer. So leukoplakia, which is white patches or red patches, you can see here that sword looks very it's not rounded, it has very uneven borders. Sometimes it can be painful, it doesn't have to be, but it can be. But something like that can turn into cancer. So again, if you notice, check your mouth. If there is any of those kind of area that you seems to be getting bigger and persistent, definitely get it checked. Early detection of OPMDs can prevent cancer. This is just like getting colonoscopy to remove polyps, right? Because those polyps can turn into cancer. So getting colonoscopy and removing polyps, you're basically decreasing chance of turning into cancer. Same way, those OPMDs can also turn into cancer. So early detection and getting rid of them also helps from stopping cancer. What increases your risk? So major risk factor, and I think far most major risk factor for any cancer is tobacco and alcohol, right? Especially chewing tobacco is more harmful than smoking. But again, any tobacco use or alcohol use are major risk factor for head and neck cancer, oral cancer. It goes same with a lot of other cancers. HPV, so human papilloma virus, that also sexually transmitted. HPV is one of the high risk feature as well for oral cancer. Genetics, sun exposure on the lips. So a lot of the cancer can occur in the oral cancer that can be part of the skin cancer, such as melanoma or squamous cell cancer. So sun exposure on the lips. Poor diet, vitamin deficiency. So you always want to make sure you're eating very well balanced diet that consistent of grains, fruits, vegetables, right? You need a lot of different vitamins and minerals for your body to function normally, to have a healthy cell growth and your immune system to work better. Not practicing safe sex. I think we want to make sure that practicing safe sex is very important for HPV transmission. So this is very important for patients who are not HPV vaccinated. HPV vaccinations are now given to all youth, teenage patients, but beyond that, I think the HPV vaccination is allowed up to age 45. It is not allowed after age 45. So if you have not got an HPV vaccination and you're after age 45, I think practicing safe sex is very important to prevent HPV transmission. 25% of oral cancer occur in people with no obvious risk factors. So just like a lot of cancers, there is a lot of other factors that goes in as well. Those are some of the major risk factors, but there are a lot of other risk factors as stress, food, the food dietary processes or the dietary habits, processed food, right? Patients who eat certain kind of food or patients who've been eating more of like processed foods. There are population studies that has been done that certain population who has high consumption of more processed food, food that has a lot of different substance in it that cause like a vinegars or substance that has a lot of smoky flavors and things like that that can cause increased risk of oral cancer as well. So again, healthy dietary habits, fresh food, daily cooked if preferred, but I think those are also other risk factors that can be modified. Obesity has linked to a lot of the cancer, so always exercising and keeping healthy weight is also important. Why older adults are more at risk? Longer lifetime exposure to risk factors, so different risk factors that have a cumulative side effects, right? So cumulative effect over time. Less frequent dental visits. Dental visit is very important, and that's where a lot of those early lesions gets catch. So dental visit every 6 months is very important, and making sure your dentist is checking everywhere for lesions and preventable spots that can be checked further. Symptom mistaken for normal aging. Cancer may grow silently, so early cancers are not painful, and we might not bring it to somebody's attention until it's causing a problem or painful. So I think that's why it can, by the time a lot of the older adults are diagnosed, they are at later stage. Why oral cancer is often found late. Early symptoms are often painless. Lesion may resemble common canker sores. Many people delay routine dental visits. Dentures may cover or mask abnormal areas. So I think for a lot of my older patients, I tell them to remove their dentures and then look around and making sure the gum line is also okay. And I think that's the job of a good dentist to make sure they check all the area. Even patients who have dentures, they should be they might not be, if they have a full dentures up and down, they might not be going to the dentist, but then the primary care physician should take care and check those areas as well. Because oral cancer grows silently, regular screening is essential. Can oral cancer be prevented? And I think answer is yes. The risk can be lowered, and a lot of the risk lowering things are listed here. So stopping or reducing tobacco, I think that's the number one thing that you can do for your health. No matter, it decreases risk for a lot of things, a lot of non-cancerous benefits, and also it prevents cancer. So stopping or reducing tobacco is the number one thing you can do for your health. Limiting alcohol intake, using lip balm, SPF lip balm. So whenever you're somebody who is spending a lot of time out, which is good, you should be, but you should always protect yourself from sun exposure. Having that sunblock on your skin, also sunblock for your lip is very important. So always protect your lips. Eating fruits and vegetables, which is high in minerals and vitamins, are also important for a healthy cell and a good immunity. So look at that picture with a nice vegetables, like look at those colors, right? So I think definitely you should have more fruits and vegetables as a part of your diet. Getting HPV vaccination, if eligible, I think the criteria is up to 45. So please get it if you are eligible. If not, then having a safe sex practice. Regular dental checkups at least twice a year. Some people do it 3 times a year, but at least twice a year. So, what is an oral cancer screening? The screening is different techniques, depends in which clinic you are at, but it's quick, it's painless, no needles, no preparation needed like colonoscopy, so it's very fast. Medical provider basically looks at your tongue, and not only tongue, under the tongue, around the tongue, you have to look at on all dimension, gums, cheeks, roof of the mouth, neck. You have to palpate for any lumps or bumps, any lymph nodes, any swollen glands. If any abnormal area is found, you need further evaluation, depends which area. They can send you to ENT doctor, or dentist can take certain biopsies. So they will be recommended based on the lesion or where is the lesion. So why screening matters? Oral cancer, frequently diagnosed late. That happens, and majority of patients, when they are diagnosed late, their survival is dropped. 5-year survival rate is about 63%, higher when caught up early stage. So if they caught up on early stage, 85% survival. So cure rate almost 85%. So it drops from 85 to 63 by 20%. And this is also based on if you're in a good area, getting that treatment early on, you're getting good clinical trials, immunotherapy, then you are on the higher side of the curve, which is 63. But we have seen that number is even worse for a lot of the underserved area. So you have to really make sure that it's catch on early stage, your chance of cure is much higher. Monthly self-check at home. Look once per month at least. Look inside your mouth with a mirror and a light. Check for patches and sores. Feel the neck for the lump, like the gentleman here. You should feel around. Also, all the way up to the clavicular area if you can. Pull your tongue in the back and check inside. Move your tongue around, up, down, sideways. Check everything. Check the the roof of the palate, also on the bottom of the tongue. So you want to make sure you're thoroughly doing the checkups. If something lasts more than 2 weeks, I think 2 weeks is a good grace period. If something is beyond 2 weeks, definitely need to bring it to either dentist or your primary care doctor's attention. Just a little bit anatomy, what to look for and where to look for. So this is the picture showing the home self-check. As you can see on the top, that's a hard palate. You want to check. You want to try to see if you can see in the back of the throat, looking at the tonsillar area. If they're a little red, inflamed, that's fine after an infection. But if they're getting bigger or one side looks uneven compared to other side, having some mass growing or irregular borders, you should bring it to somebody's attention. The surface of the tongue, so the bottom of the tongue, you also want to check on the lateral surfaces. So put your tongue on the sideways and make sure you're also checking the lateral borders. You want to check the mucosa, so always lift up, check the gum lines, lip area. You want to check underneath the buccal mucosa. So always do this thorough examination as is shown here on the pictures. Examination of a lesion required physical examination by a healthcare provider by looking inside your mouth. Depends on the lesion, how big it is, or what kind of lesion it is. It might be simple as just a brush biopsy, where healthcare provider basically take a small brush or a spatula to gently scrape off the area to obtain cell for analysis to see if they're cancerous or not. Some requires probably more of in-depth biopsies, so dental exam or biopsies, which is basically more of smaller tissue, but more of in-depth from the lesion. Indirect laryngoscopy or pharyngoscopy. So a lot of you can do self-examination of the buccal mucosa in the mouth, but if the lesions are beyond there, is not you cannot visually see it, right? But if you have any of the symptoms I was protruding to earlier, as far as swallowing, difficulty swallowing, or hoarseness of voice, or pain in ear, any of those might require to check for your larynx and pharynx, and that's usually done by ENT doctor, putting a scope down your throat and to see if they can see any lesions there. Healthcare providers use small mirrors on a long hand to examine the throat, the base of the tongue, and part of the larynx. Incisional biopsy requires much of ENT doctor to go in, probably numb the area and take a biopsy. So healthcare provider has to do that. Direct pharyngoscopy or laryngoscopy use an endoscope. That's basically thin tube with the lens and camera on the top that goes inside, examine your throat and mouth area. And at times they can also take a sample if they see any abnormality. Stages of oral cancer. Stage 1 is a tumor in your mouth, measures 2 centimeters or less. Stage 2 is a tumor 2 centimeters or smaller, but isn't larger than 4 centimeters. So it's between 2 to 4 centimeters. And stage 3 is when it's larger than 4 centimeters. Like any other cancer, stage 4 is when it spreads to the other part of the body. For oral cancer, just having a lymph node involvement is already stage 4. That's already locally advanced. So as you can see, why is very important to catch it early, right? You see here the size. T1 tumor is small, T2 is a little bit larger, But T3 is already started being locally advanced. T3 requires major surgery, and if the lymph nodes are involved, that's like stage 4 at times. Depends on the which side of the lymph node. But again, it is very important to catch that while at that T1 or T2 lesion. Treatment options are multiple different modality, depends on which stage of cancer you're in. So surgery is the main way we take care of those cancer unless they are metastatic or they are locally advanced where they are in direct touch with some organs such as like artery or vessels that we cannot operate, or it will be a high risk of blowing any of those vessels. So majority of time surgery takes care of those cancer. Then depends on the features after what we took out from surgery. If they have any high risk feature, that patient needs radiation. If they have a lymph node involvement or tumor was T3, T4, very big tumor, those might also require radiation. So after surgery, a lot of time you do radiation to decrease the chance of recurrence. Chemotherapy is another treatment we do along with radiation at times. Chemotherapy, basically for head and neck cancer, we give it with radiation more as a radiosensitizer. We know certain chemotherapy sensitize the cancer more to the radiation, and that's what we try to do. And then immunotherapy, if patient has a locally advanced or stage 4 cancer, immunotherapy is one of the newer line of therapy that we use. I do not know if you guys know about immunotherapy, but that's a new form of treatment. It's been out there for 10 years. We have been treating multiple different cancer. Immunotherapy has indication in any majority of cancer you can think of. And immunotherapy basically primes your own immune system to fight against cancer. And head and neck is one of the cancer that immunotherapy works very well. In any setting, we have done immunotherapy in a stage 4 setting as a palliation, and now immunotherapy is also approved in adjuvant setting. So after patients who have surgery, radiation, chemo, radiation, we can give immunotherapy to decrease chance of recurrence. And now more we utilizing immunotherapy upfront to patients who have locally advanced cancer, try to shrink their tumor before surgery for better surgical outcomes. So immunotherapy has been definitely one of the newer and better options for those patients. Now, we are at Steeplechase Cancer Center, part of Robert Wood Johnson Barnabas Healthcare System. We are NCI designated cancer center, and we do have great robust program for head and neck cancer, oral cancer. We do multidisciplinary care. What it means, you get radiation, surgeons, medical oncologists such as myself, everybody under the same roof. So it's very important to have your care team under the same roof. Beyond just medical doctors, I think you also require a lot of different other multidisciplinary care, such as social worker, dietitian, occupational therapist. Those are very important after surgery to make sure you get your chewing and swallowing ability back. You're getting your speech therapy. You want to make sure that you get majority of functionality back. So that multidisciplinary care is very important, which we make sure is provided to all our patients from the get-go. As soon as they come to Steeplechase Cancer Center from the day of diagnosis, they meet all those different team members and we work all together. Patients require clinical trials. We are proud to be NCI designated, so we have a lot of clinical trials, and you do not have to go to many far away to a different institution. All our community sites are equipped with the clinical trials, and you can get new treatments like immunotherapy, and there are now more and more new treatments coming out for head and neck cancer that are available to you in your backyard. So final takeaway from oral cancer screening and prevention, we want to make sure, just like any other cancer screening, head and neck oral cancer screening is also very important. It can not cause any symptoms or pain in early stages. So that's why self-examination, going to dentist, going to your primary, get it checked every 6 months is very important so we can catch lesions earlier, get rid of them, and can be cured from it. Early detection saves life. 85% cure rate if we detect it early. Not only smokers or heavy drinkers are affected, as we saw a lot of other risk factor. 25% of patients did not even have those risk factors that we discussed. So there are other things that can contribute to head and neck and oral cancer as well. Screening is quick, painless, simple. So make sure you get it, you do the self-examination, you have control over prevention. So continue. I hope this was helpful and at least you know what to look for and bring it to somebody's attention. Those are my references. And thank you. All right, I'll take some questions. I'm going to stop my screen share.
Thank you so much, Dr. Patel. That was very informative, and we haven't covered oral cancer or oral cancer screenings before, so thank you. I do have some questions that I asked my team, or asked my team to come up with a few questions because I know we're not going to be able to do the live portion. So it's about like 9 to 10 questions, and I'll start and you can answer.
Yep.
So, how would you go about educating dentists and dental assistants on how to conduct a brief oral cancer screening exam during routine visits?
So I think I will go and show them those are the 9 pictures of the areas that definitely needs to be examined. When I go to my dentist, they do such a great job and I love it. Like at least, not they check the mouth, the cavity area. They want to check the buccal mucosa, the palates. Underneath the tongue, they also need to check the back of the tongue, and they also look for any lymph nodes or they palpate. So the self exam that we taught also that has to be done by the professionals. So we always make sure that it gets done in the dental office. If for any reason, if your dentist is not doing it, just ask like, hey, can you just do like a prevention or just screening exam for oral cancer? And I think that's usually what it consists of, and they should be doing it.
Okay, that's good to know that we should be asking these questions, if they're not already doing it. What strategies would you recommend with dentists that do not want to discuss HPV vaccination with patients?
I think HPV, not only dentists, I think it's also a role of the primary doctors to educate the patient on it. I do tell all the patients to inquire and discuss with your primary doctors if you meet the criteria, right? So you have to be at a certain age, as I mentioned, 45, I think. So talk to your primary care doctors. Tell them why you would like to get an HPV vaccination. I don't think so there should be any hesitancy or any reason that they should not be able to give it to you. A lot of the Minute Clinic that also provides like vaccination clinic that you can just go and get it done as well. So I think you should definitely talk to primary care and ask for it. After 45, unfortunately, the insurances do not cover it. So you might have to pay out of pocket. And I think a lot of time they do not cover it after age 45. But I think at that time, just practicing safe sex techniques, I think is important. HPV transmission is mostly from transmission, sexual transmission.
Thank you. And so if someone doesn't have great oral hygiene, what is the most important tip to prevent cancer?
Yeah, I think first and foremost, go to the dentist. I think it requires to get rid of those buildup of plaques and the gum teeth, and if people have infection like orthodontist, you need to get a deep cleaning, things like that. So I think that's the most important. Keeping the inflammation down in the mouth area is very important because healthy gum, less inflammation, there is a less chance of having any of those precancerous lesions. So I think going to dentist is very important to get rid of those pre-lesions, or at least get good, healthy gum and healthy teeth for the life of whatever the patient has left. Um, just routine like brushing, twice a day. Flossing is very important, right? So a lot of time people don't floss, and I think that also causes a lot of the gum disease. So I think flossing is very important. Use the mouthwash at least twice a day. There are multiple mouthwash available. There are mouthwash that are alcohol free as well. So I think those are good. So use the good hygiene techniques at least twice a day. I will say brush. If not, floss after each meal. I think that's one thing you can do.
I know I always get told that I don't floss enough.
Dentists are never happy, no matter
No,
how much.
they're never happy. She already kind of knows when she goes to see me. But I am trying to get better at it. Um, so I know you actually kind of covered this. So I believe you said if there's like swelling, pain, like any sort of symptoms, wait at least like 2 weeks probably before going to the doctors.
Yeah.
Because the symptoms are so.
Yeah, 2 weeks are a good mark when, we don't want to go like panic about every single thing that happened, right? And some of those things are normal. It can happen after a viral infection, or if you like bit yourself on one side, but it all heals, right? If it's anything benign, viral, things gets better. So if things gets better, good. If things continues to progress and continues to get worse beyond 2 weeks, that usually not normal, and that somebody needs to check it out.
Okay, good to know. And I know we talked about tobacco use, but I was actually curious on vaping and like marijuana smoking. How much do they actually raise the risk for oral cancer, and gum issues compared to regular cigarettes as well?
Yeah, I think vaping is definitely injurious to health. Vaping is very new, and I don't think so we have as much as data as smoking. I think smoking, we have learned a lot from years of experience that it is very injurious to health. I think vaping is pretty much same. Anything that cause inhalation injury, constant inflammation, and we have seen that with vaping that it does cause a lot of damage to your breathing pipes and your lungs. So I will assume you over time, and I think time will tell and data will tell, but I think it will be pretty much same as smoking. If not, maybe more dangerous. When smoking came also, right, the first few years, nobody thought of that being injurious to health, right? And now we know. So I think vaping is no different. I think they market as right now being more safe, but there has been shown a lot of data of an early injuries to lung, early injuries to your breathing pipe. So I think I will say right now we do not know exact risk, how much it is to develop cancer, but I will stay away from it as well.
Okay, yeah, that's what I figured. I feel like the data hasn't totally come out yet, but I think it's, yeah. And so by avoiding tobacco and alcohol, are there specific dietary patterns that public health educators should be promoting to reduce long-term oral cancer risk?
Yeah. I think smoking cessation, alcohol, um, the tips that we went over, HPV vaccination, safe sex practices, um, eating healthy, right? I think that's one of the main thing we ignore, or we try to do it when it's too late. This happens to me every day while I'm seeing a new cancer patient. They're like, "Can we do something to get better, or while we're getting chemo, what can we do?" And I'm like, yes, eating healthy, exercise, good sleep. Unfortunately, we do it when it's too late, and we don't change our habits early on. But I think those are very important things, right? Eat healthy, exercise, maintain good weight, good sleep. And I think those are the mainstay of staying healthy. And I think more than anything, that will help decrease chance of cancers. And of course, staying away from alcohols and smoking.
Mm-hmm. And I know you also mentioned genetic risk. Is there any specific condition that are high risk indicators of oral cancer?
Yeah, very few. There are certain genetic condition that leads to like more inflammation, ulceration in the mouth. It's very rarely seen, but it has been seen as it's like less than 5%. But those certain conditions can lead to increase in oral cancer risk. But usually those patients has multiple ulcerations in the mouth, and they have been getting that for many like years from since their teenage years. So is very usually those patients gets frequent checkups and they're aware of their cancer risk.
Um, and then I know we spoke a little bit about like your team at Steeplechase, and you mentioned like the speech pathologist that you work with. So I wanted to ask if you could discuss a little bit about the long-term implications of surgery, radiation on speech, and how that impacts a patient's ability to navigate their own life after their social, professional life.
I think it depends on how extensive surgery or which part of the mouth was affected from the cancer. I have seen some major surgeries and then patient reconstruction. They make the jawline from the taking one of the bones from your leg, and they make the jaw again to have that chewing ability. And speech therapy is excellent. It takes time, but then patients I have seen getting back to their speech abilities. Majority of times they're back to at least adequate to do their daily activities and getting their quality of life back. It might not be back as how they were before everything happened, but pretty close. And I think this is where a lot of those specialties are very helpful to gain that functionality back. But yeah, as I said, I have seen patients with major surgery and then they come back with like nice reconstruction back to like their speaking, chewing, and eating, and maintaining that calorie intake that they do not need uh, feeding tubes or anything like that.
That's great to hear. Um, is there one specific myth about oral cancer that you find yourself constantly debunking?
Yeah, I think a lot of people think that only chewing tobacco are making them high risk. Smoking is safer than chewing tobacco. That's what they think. But I think the risk is pretty much similar.
And this is my last question. Earlier in the presentation, we talked a little bit about New Jersey statistics. Do you know how we compare to the rest of the country?
We have an increase in incidence of head and neck cancer, and I think that has to do with probably like a dense population also. We also have a higher population of aging individuals, and I think a lot of the way we have exposure in New Jersey as well, right? I think it has to, a lot of things also goes back to um, other exposures like in environmental exposure, like a radon exposures and things like that, right? So I think that is also some prevalence in New Jersey. Although data is more on the radon to lung cancer, but we do not check a lot of our water for a lot of different things. So who knows?
Thank you so much. That's all the questions that I have today. But I know our audience will probably have some more questions, so I'll tell them to put it into our Mighty Networks so you can get a chance to look at them and answer some of them.
That would be great. Thank you so much for having me.
Thank you so much. I really appreciate it.
Take care.
All right, and now I'm going to transition back into our slides. I haven't checked the chat. I don't know.
I had a couple questions and we do have one other question in there, so we'll put those in Mighty Networks.
Mm-hmm. Sounds good. And now we have the post test. So, regular dental checkups twice a year can help lower the risk of oral cancers. True or false? Oral cancers can develop without pain in the early stages, and HPV is one of the major risk factors for developing oral cancers.
And let's just give it another maybe 30 seconds so that we get good participation. I just need a few more people to complete the poll. And then so while we're waiting for the poll to be completed, I'll read the question in the chat for everyone. So would be interesting to know when and how people have been diagnosed with oral cancer, if it has been through a PCP annual checkup or a dental checkup screening, or for some reason it's blocking, or just when the person is seeing and experiencing that the cancer has grown and is having painful symptoms. So I think that's a great question. I haven't seen any upticks in the poll, so I'm going to go ahead and end it and share it.
I agree. That would be really interesting to know. Um, and then here are the answers. Um, all of them are true. And then I have a few more slides to go over. So in our state, we have NJ Seed. They provide free cancer screenings for breast, cervical, colorectal, and prostate. And then the phone number and the link for that will be in the chat. Okay, now my screen. And thank you so much for attending today's session. Please let us know how we did. Use the QR code or the link, and the link will also be in the chat. Mighty Networks, everything will be posted to there. The presentation, the recording, any other resources that Dr. Patel wants to share, and he'll have the link to that too. So if you ask your questions there, I'll post them anyway. But if you have questions later and ask them on there, he will be able to answer you directly. And then coming up with the screening and prevention series, join us June 10th for a session covering men's health. And then for the rest of May, we have two more echoes. We have an echo on May 21st talking about World Tobacco Day, and we are offering CHES credits. So make sure to stay tuned for that. And everybody will be getting a notification, and it'll be on the Mighty Networks too. And then Survivorship Series is also May 28th this month, which I believe is a Thursday instead of our normal Tuesday. And that will be the impact of primary care physicians on survivorship. And then